Come on up. There's plenty of seats. Find a place at the table. There's plenty of seats up the front here. There's 4 here, 7 here, and 9 over here. come over here if you want. Okay. Welcome everyone. I'm so glad that you've joined us tonight for our dinner and dialogue. Thank you. It's been a wonderful conference so far, and I'm excited to continue to learn from all of you and from our panelists here. In keeping with the tradition that Michelle has started, we'll try to be on time and actually start on time and finish on time. So that's exciting. On behalf of the Church of Jesus Christ of Latter-day Saints and the millions of members and friends who donate to its Global Humanitarian Relief Fund, thank you for joining us for dinner. I'd like to thank the World Food Prize for continuing to support Norman Borlaug's vision that every person born on this planet have enough food to eat. Similarly, if I could ask the staff or volunteers with CLE Productions, the Event Center, or the Borlaug Dialogue to either stand if you're not standing yet, and if you are standing, to just maybe raise your hand. Can we pause and give these professionals a round of applause and a huge thank you? We have no idea what it takes to put an event of this size together and to make it as flawless as they have. The fact that we have microphones that are working, you each have a seat, there's food, the temperature has been great. This has been a lovely event, and we're grateful for the sleepless nights and the additional time they've taken to make it so. Okay, so I am going to, my name is Honey Cross, and I manage the Nutrition Consortia efforts of the church in both Africa and Asia. And our goal tonight is to foster an environment of meaningful dialogue. Now, to do so, we've invited our panelists to give us just a taste of examples that they've seen that build resilience in both soils and communities. There's 4 seats up here in the front. There's a whole table over here on the left front. Please, come on up. This is an informal dinner discussion. Pretend like you're having a dinner party at home. Just come on in, find a space. Okay. So as I was saying, we've invited our panelists that are here on this stage with us to share a story or an example of either a person or an intervention or a program that they believe has the potential to impact a community for the better, for the long term, so sustainable efforts. As was said earlier this week, we know that potential doesn't feed anybody, so we're hoping that, no, please come, there's a place right here. We're hoping that you take away from tonight something that you can do whenever you go back home to your own spheres of influence to have impact and accelerate community enhancement, resilience, sustainability, but recognizing that each person in this room is intelligent, has a different skill set, and has something to offer, regardless of what's happening in the chaos of the world. Each of you have the ability to literally change the world from your sphere. And we hope that you'll take away tonight one idea that comes to your mind of who should be at your own tables of influence at home, who should be invited, who you should be participating in and working together with in a more formal setting, and how you can do work differently in a way that accelerates impact, especially in resilience and climate-friendly solutions. So we are going to do things a little differently here tonight. We're going to have about 30 minutes for our panelists to chat, and then they're going to leave the stage and join you at the tables. So we're going to have 45 minutes of good old-fashioned dialogue. We have seats up here at the front if you'd like to join us. So I'm going to be the timekeeper, so you don't have to worry about that. And the intention here is while they're talking about some examples, maybe you've got some questions or you have some ideas or some opportunities that you want to share with us. And so we're going to dive in a little deeper. At each of your seats or plates, there is a fact sheet about some of the programs they're going to talk about. So that's your deep dive opportunity. But the floor is open to discussion. So we're excited to be able to learn from you. I would ask you for one favor before you leave tonight. You should each have a small globe on your plate somewhere. It's a paper, you can plan it. It's blue and it has some colors on it. And you should each also have a pencil that can also be planted. While you're talking or listening, you're going to have an idea. You're going to say, I thought about that before. Or you're going to think of a person that you really want to work more closely with back home. So I'm going to ask you to write one word on the back of that piece of paper, that little tiny globe, and I'm going to ask you when you get home to both figuratively and literally plant that idea. Because these conferences and meetings and the opportunity to connect and to be face-to-face are only as good as the work that we take back home with us. So everyone should be thinking about what they, as you have an idea, please, we have lots of seats up here at the front. There's 3 or 4 here. As you have an idea, write it down on the back of your globe, and then when you go home, act on it, and then plant that seed. Okay, I'm going to turn the time over now to Arun. Let me introduce our moderator tonight. Arun Baral is the CEO of Harvest Plus. He oversees the development and delivery of micronutrient-rich staple food crops to reduce micronutrient deficiency in communities with high rates of acute malnutrition. Arun has over 30 years of international agricultural experience in both the private and the nonprofit sectors. He holds an MBA from Drake University here in Iowa and a Bachelor of Commerce with honors from Delhi University in India. Now, Arun, before I turn the mic over to you specifically, I do have one question I want to ask you. Would you take a moment and tell us what you're most excited about right now with Harvest Plus?
Thank you, honey, and thanks for the opportunity. I'm glad to be here, and welcome to everybody. So for Harvest Plus, the thing I'm most excited about is the impact it is poised to create in improving lives, livelihoods, health and nutrition of millions and millions of smallholder farmers and rural communities in the global south. And what I mean by that is, we have created our sort of mechanisms and models that are taking innovations in nutrition, agriculture, to the last mile beneficiaries at scale, and in a very sustainable manner. And what do I mean by that? Let me give you some examples. We worked with CGIAR, our partners in innovation, CIMMYT, Harvest Plus, and National Research Agricultural Systems in Pakistan, and we released a variety of wheat which is very high in zinc. 5 years later, that variety is almost producing half of the country's wheat production. Half of the country's wheat production. And it is like, fluoride in the water kind of concept where people are getting zinc by eating local foods on a daily basis. And it is all being done with the private sector involvement, the public sector involvement, and we have only 4 people in the country making this happen. Similarly, this model is being deployed in Africa, in Zimbabwe. We released with our partners beans, common beans that are high in iron. And iron and anemia in women is very, very sort of important health issue in that part of the world. And almost 30% of the bean area in Zimbabwe is being planted with these beans that are high in iron, addressing anemia, addressing cognition for people. And similarly, in Nigeria, we released with our partners maize, which is very high in vitamin A. And today it's being planted on almost 22% of the total maize area. So I see this as a real transformation of food systems. And we have created an organization, a separate organization that is dedicated to drive this impact. And through partnerships, and that's called Harvest Plus Solutions. And the private sector is really responding. So I'm really thrilled about that. And the second thing, honey, I would say is our school meals program, where we are bringing, nutrition into school meals. Food needs to be nutritious. We forgot about that. We have calories, but we don't have nutrition. And this is what we are trying to bring back. We started this program about 2 years ago, and now we're reaching about 1 million children in Africa and Asia. And with our new model that I just described, I think the impact potential is huge. So those are the two things I think are game changers, and all these are very sustainable models that are also local and resilient. So those I would say is some of the things that keep us going, even in this difficult environment. So with that, let me turn over to the panel, and let me introduce the panel. I'll read out their backgrounds and intro, and then I'm going to be asking a few questions from the panel. And please bear with me as I fire up my phone here. So let me start with Rolf. Rolf is the Vice President of Nutrition at Helen Keller International and holds a joint faculty appointment at the Johns Hopkins Bloomberg School of Public Health. With over 35 years of global experience, he has led major initiatives across Africa and Asia to advance maternal and child health, micronutrient interventions, and resilient food systems. Rolf translates evidence into effective policy and practices and leads the global nutrition strategy and research agenda centered on high-impact interventions, and is driven by a belief that good science, good humor, and good hearts belong at the center of building a more nourished and just world. Rolf. Let me move to Stephanie Ashley, next to Rolf. Stephanie is the Maternal and Child Health Project Coordinator with the Hunger Project in Ghana. She leads the implementation of maternal and child health initiatives across all the Hunger Project operational districts and integrates agriculture and food security interventions to improve nutrition outcomes. Stephanie actively engages key health stakeholders at all levels and brings extensive knowledge and experience of Ghana's health service delivery systems. Stephanie holds a Master in Public Health from the Kwame, how do we say that? Nkrumah University of Science and Technology, Ghana, and brings over a decade of development experience. Welcome, Stephanie. Heather DeLong, next to Stephanie, Senior Technical Advisor, Sustainable Agriculture on the Food and Water Systems team at CARE USA, where she leads global strategies on regenerative agriculture, agroecology, and food loss and waste. With over 20 years' experience in advancing sustainable food systems across 4 continents, Heather drives CARE's integration of ecosystem-based adaptation, circular food economies, and women-led approaches into agriculture programming, and she holds a Master of Science in Sustainable Food Systems. Welcome, Heather. Next to Heather is Sushil Ghimire. Sushil is at IDE Nepal with over 20 years of research and development experience in Nepal, India, Yemen, Israel, integrating market-based agriculture and nutrition system approaches across public, private, nonprofit, and government entities. Welcome, Sushil. Representing the Church's humanitarian development work across African continent is Olga Bongo. Olga has 20 years of international development and refugee resettlement experience and currently consults on area-led sustainability initiatives. Welcome, Olga. So let me start with the first question to the panel here, starting with Rolf. Rolf, would you take a moment to introduce your current work, your approach, or what you see as being the most impactful work in your respective fields?
So I'm going to stand up because I've been sitting too long, if you don't mind. And so thank you. It's really an honor to be here. And I just want to take a moment to address the students. We've all been in your seats, and it's a privilege for you to be here. So take advantage of it. But remember, we were in your seats before, and sometimes you get awed. I mean, there's a lot of people, even for me, I'm awed by some of the people I'm standing in front of. But, you know, we learn by mistakes. My appeal to you is challenge. Challenge us with questions. We get old, we get grumpy, we get set in our ways. You guys are seeing this with new eyes. So please, challenge us with your vision, challenge us with your ideas. So I'm Rolf Clem, and I'm with Helen Keller International. And what's our mission? Our mission is to translate science into applied programs. I mean, that's what we do. We try to ensure that evidence-based solutions reach real families, especially women and children in vulnerable communities. So my work and our organization's work sort of sits at the intersection of nutrition, food systems, and policy. And we try to focus on taking things to scale, those things that are evidence-based, but that are locally translated. And those things are critical. You need evidence-based, and they need to be adapted to local circumstances. So let me give you a face, sort of put a face on what I think is an example where I've seen impact. After a monsoon flood in Sylhet, Bangladesh, it's in the northwest, a woman named Salma Begum stood ankle deep in sort of a muddy garden patch in a courtyard where she had a small garden at one point in time. And those of you who have been in Bangladesh know it floods all the time. And through a kind of multi-sectoral Suchana program, which means the beginnings in Bangladesh, she actually learned how to bring her soil and actually her hopes back to life. And what did that look like? She actually learned how to compost kitchen scraps and chicken droppings. Now that seems simple to us, but that wasn't there. Planted orange-fleshed sweet potatoes, amaranth, and spinach, and raised a few local, not hybrid or imported, hens beneath a mango tree. Pretty simple. And within months, her barren yard became sort of a thriving microfarm. And what were sort of rice and lentils on a plate became a much more colorful and more nutrition-dense plate for her children. And her 2-year-old, who was undernourished, began to thrive. And when she said healthy soils grow healthy food, and healthy food grows healthy children, she captured what I think we see across our work, from Nepal to Bangladesh to Senegal. That is regenerative, nutrition-sensitive agriculture doesn't just heal the land, it heals lives. It transforms depleted soils into productive gardens, women into entrepreneurs, and children's futures into something sturdier than just the harvest. And that's why our approach goes beyond feeding. It's really about nourishing. And I'd just like to, quote Norman Borlaug, who said, "You can't build peace on empty stomach." And I'd like to add, you can't build resilience without nutrition at the core. Thank you.
Thank you. Thanks, Rolf. That was wonderful. I pose the same question to you now, Stephanie.
Hello. Am I audible, please? Yes. Okay, perfect. So I work with the Hunger Project Ghana, and our vision is to create a world without hunger. So we work in Africa, Asia, and Latin America. We have about 13 countries which we refer to as program countries. And for partner countries, those are mainly in the US and Europe that raise funding to support project implementation in the program countries. And our approach is focused on 3 key strategic pillars. We start with women. We empower women. We help them identify their potentials. And we constructively engage men as well. we partner with government institutions that ensure sustainability after most of the projects have been rolled out. And we also work with communities. We mobilize cluster of communities, about 10 to 15 communities, so that they can champion their own development. Regarding work that we've done, with the support of the Church of Jesus Christ of Latter-day Saints, we are currently implementing a project called the Hope MCH. I'm sure you've seen the documents on your table by now. And it's looking at improving maternal and child health in most of the communities in Ghana. We are actually deploying an integrated and multi-sectoral approach where we bring on Born Wash. We also include the disability inclusion. We also have health and nutrition. We focus on improving facilities, training health workers, providing them with medical equipment, and also providing them with multiple micronutrient supplementation. In there, it's food security and agric as well. We also touch on maternal mental health. So it's a holistic approach towards improving maternal and child health. Regarding the impactful work that I would like to highlight, it has to do with an evidence of localized adoption of practical demonstration of the food security work and interrelation between soil health, food security, and nutrition work in the communities where we work in. With the support of the church, the project has implemented, so far we've gone 1.5 years, yes, and we have trained over 1,000 skilled mother farmers. So these are mothers who have been taken through a mindset change training and have identified their potentials, moved from I can't to I can. And in collaboration with our government institutions, particularly the Department of Agric Extension officers, we have trained them in regenerative agriculture, how to utilize organic manure so that they can revamp the soil and grow nutrient-dense crops. We supported with a couple of seedlings and seeds, and so far we have a huge impact. Mothers now have cultivated home gardens in their homes, and they have access to nutrient-dense crops, which is actually improving their nutrition outcomes and leading to the reduction of malnutrition in their communities. Thank you.
Great, thank you. Heather?
Hi, everyone. Thank you so much for having CARE. I have to share, I just have to, being on this stage. Before CARE, I actually ran a farm for 14 years. So the young farmer girl in me is awfully excited to be on the stage right now. So thank you. But I'm going to talk about CARE's work in supporting women's small-scale farmers. And we take a whole systems approach to our work and really look at regenerative agriculture, nutrition, water, climate, and focus on women's needs. And also engage men and boys. So we do not only focus on women, but the whole family. But I really want to talk about our approach to regenerative agriculture and just 3 key areas that we focus on. We have actually a very robust approach, but these are related to a story that I want to tell you a little later. So the first thing that we do is we center fairness. So women are at the center, and fairness is really at the core. So we ensure that women have the opportunity to participate and to engage in leadership opportunities. And we also try to ensure that we increase access to resources and assets that are not always equally available to women, such as land, water, technology, finance. So ensuring that that is more equally available. The second area that I want to mention is we bridge knowledge. So existing knowledge, including traditional and indigenous knowledge, with new skills and knowledge in regenerative agriculture, nature-based solutions, agroecology, and ensure that women have the skills, training, education, opportunities to really make informed decisions that are best for them, whether it's about soil health, nutrient management, ways to increase biodiversity, access to or the ability to create natural inputs. But we also integrate nutrition-sensitive agriculture. So in the way that we promote practices that boost micronutrients in crops and also increase access to a diverse amount of crops and foods. And then the other thing I would like to highlight is reducing burden on women. Farming is by far the least very, very intensive career. So we look at ways to reduce the burdens that women already have on their time, their labor, their energy, their cost, and try to develop solutions that do reduce this and improve overall quality of life and day-to-day work. We do this in a number of ways. We have several different methods, including our Farmer Field and Business School approach, where we have demonstration farms, women can come together, learn new techniques, new approaches, and also learn how to adapt different techniques per their context, per their climate, environment, their soil, their needs, and really decide what's best for them to take back to their communities, their gardens, their farms. So the question about impact and what I'm really excited about is, I think this is true for everyone here and so many people that I've been meeting, is that understanding that none of this happens alone. We don't achieve all of the results that we want in soil or malnutrition just by focusing on one thing. So the understanding that we're working on soil and restoring soil, but also ecosystems and nutrition, and doing that in partnership, I think is one of the most exciting things, and really watching that grow as we're in a changing environment.
Thank you, Heather. Sushil, would you share your thoughts?
Thank you, Arun. Yeah. Greetings and good evening, all. Yeah. I represent ID. We are based in Denver, Colorado, and we work around the globe. Yeah. Before actually I say something about ID, it is important to share with you each and every individual and the institution, they exist to answer their why question, why they exist, and then comes the how they actually deliver that why and what the things they do here. So why ID exists is to alleviate poverty and to reduce malnutrition around the globe. Yeah, that is the core focus of the organization here. And whatever we do, the how and what is actually focused on that mission to alleviate poverty and reduce malnutrition. Because poverty is perhaps the most solvable problem we are facing in 21st century. Yeah. And how we do it, because there are different approaches, different models, but ID believes on market. ID believes on the private sector-led the changes, and ID believes that the entrepreneurship can address the problem we are facing currently here. So we mobilize the market, and we firmly believe on change, not charity. So our action hardly actually create any dependency, because we want to bring the changes, and we don't want to be seen as a charity organization here. That's how it comes the market here. Because we are also convinced, if we want to reach at scale, if we want to impact to the larger the clientele here, there are only two ways to go. There are not any magic bullets. Either you have to engage or mobilize the private sector or the market, or you bring policy changes or the government. Because if you see who have the money, either it's the government, because they are the tax collector, or the private sector. So we don't have other options. Yeah. With charity, maybe we can impact very quickly, but we cannot reach to the scale. We cannot impact to the larger number of the people. And how to do that actually, then comes the innovation. With small innovation, actually private sector can impact a large number of the households. And we have very good success stories like in Cambodia with small innovation in the latrine design. More than 100,000 latrines were sold. And with small innovation on the poultry sector in Nepal, now we are going to work with the farmers in 12 districts, actually, with small innovation on the contract farming here. That's the things, and now it's coming not only the poverty reduction, we have to see, okay, they are resilient. Now it's come to the regenerative agriculture, we have to focus on the soil. But it's very challenging for IDA because we follow the market-based approach and we have to convince the private sector to invest on the regenerative the agriculture and the recycling business model. So that's the where actually innovation comes. And we have very strong innovation department, innovation unit. They 24 hours throughout the week, they always actually try to innovate the process and the product so that the we can also bring the changes through sustainable measures. Yeah. Thank you.
Thank you, Sushil. Very comprehensive. Moving on to Olga. Olga, would you like to share your experiences?
Sure. So it's an honor for me to be here today. As introduced, I support 3 areas in Africa in their humanitarian efforts. The Africa South, Africa Central, and Africa West. Since we're here talking about soil, food security, I want to mention that the church addresses food insecurity and malnutrition by making significant financial commitment and by working with local government and organizations that have expertise in food security. Organizations like Helen Keller International, the Hunger Project, CARE International, IDE, World Food Program, and others. The church prioritizes maternal and child nutrition, especially in early childhood, to ensure that mothers have the knowledge that they need to provide care and nourishment. Now, when it's come to the approach, the church is helping in 2 ways. First, by feeding those who are hungry now, and it's done through the church emergency initiatives, emergency response initiatives, and by also solving deeper problems like poverty, poor nutrition, lack of agriculture knowledge, and it's done through the church development initiative to ensure communities become self-reliant. Now, when it comes to the question about the impact, the Hunger Project has mentioned the impact because we partner with them, but we hear this impact from beneficiaries themselves. We get great reports from organizations that we collaborate with. We get great reports from local partners, from governments. Allow me to read some of the impacts, so I want to make sure that I get them right. What we're hearing is with our initiatives, there's increased agriculture productivity and diversity. There's greater household food supply and income from sales. There's strengthening local food systems and reduced dependency on imports and aid. there's reduction in malnutrition, stunting, especially among children and mothers or women. There's increased resilience to climate shocks and economic instability. Thank you.
Wonderful. Thank you, Olga. Let's do one more round rather quickly. Some of our panelists talked about women, and we know that women make up 40% of the global agricultural labor and also bear the brunt for food insecurity and malnutrition. How have you seen women leading change to restore soils and improve nutrition in their communities? Well, Ralph, can I start with you?
Yeah, I'm going to stand again, if you don't mind. Yeah, I mean, when we talk about restoring soils and improving nutrition, a lot of times we've heard this time about investment and technology. But in flood-prone wetlands, like in Bangladesh, I've seen regeneration begin with women. Women who don't necessarily start with capital or credit, but who start with compost and courage. And again, I'm going to use an example from Suchana in Bangladesh, and a woman, Alima, who has 3 children. And when we first met her, she also has, as is common in Bangladesh, a courtyard that was kind of cracked and parched. And through Suchana, again, which was a multifactorial, as many people have alluded to here, it's not just focusing on one aspect. It was really learning how to take local resources, whether it was how to make biofertilizer from kitchen waste and cow dung, intercropping leafy greens with nitrogen-fixing pulses, and harvesting rainwater during the dry season. And within a year, you actually can see transformation, where you actually have diversity in garden production, where you're seeing things such as moringa, amaranth, pumpkin vines, curling up bamboo poles. But it doesn't stop there, because it also is women's agency. And this particular woman actually ended up becoming a village model farmer and teaching 20 other women. And I like stories, but I'm also an academic. And I had a professor who said, "In God we trust, but everybody else bring data." And we had the Institute of Development Studies at UK actually evaluate this project. And they found across 235,000, not 900, not 20, not a few thousand, 235,000 households that were supported by Suchana, women like Akima had restored soils, diversified crops, and transformed nutrition. And just to give you statistics, we measure these things. We measure what people consume. We measure what people grow. And women's meeting minimum dietary diversity increased from 26% to 51%. Well, that means half of women are still not getting what they need. But that was a huge increase. But you started with only a quarter of women getting the minimum. Minimum dietary diversity scores for children 6 to 23 months went from 2 to 3. That means kids are getting 3 food groups. Now that's inadequate, but it went from 2 to 3. And so the final evaluation also showed that 8 out of 10 women sustained the homestead food production a year after the program. 7 of the 10 households that received income generation support were able to make a profit. Well, 30% didn't. Not everybody is an entrepreneur. There will be failure. And Suchana households were twice as likely to be food secure as they were at baseline. These are all published in peer-reviewed journals, so you can actually look at them. So the point I want to make is that women weren't just growing food. They were growing agency. They were teaching others. They were engaging with extension services and showing that soil health is not separate from social equity. And so it meant also that this change went beyond also individual gardens. The government picked it up. Seed companies now are printing nutrition messages on the seed packets. So my challenge from this to myself and to all of you who are sitting here is this. What if we treated every woman smallholder as a soil scientist, as a nutritionist, and a change agent rolled into one? What if our investment trusted her knowledge as much as our own data? Because when women like Alima are equipped and respected, they don't just restore soil. They restore our shared faith that regeneration begins from the ground up, and that nourishment, and this is difficult for me as a public health nutrition scientist to say, that nourishment is as much about dignity as it is about diet.
Excellent. Thank you, Rolf. Stephanie,
Yeah, my thing.
would you like to share? Yeah?
Yes, most definitely. Thanks, Rob. I think I have a similar story to what he shared. I don't have my statistics here, but I'm sure later I can share through the church so that you have evidence of that statistic. So we have seen that change obvious in the lives of the women in the community where we work, one woman at a time, a community at a time. So I mentioned earlier that through our empowerment model, we supported over 1,000 skilled mother farmers with a couple of training in collaboration with the government, specifically the Department of Agric Extension Services. Yes, so I will highlight one person from one of our communities that is benefiting from the Hope MCH project. She is called Aishetu, and she is from a small community called Techikrom, under under Chempo Epicenter. So when I say an epicenter, it's a cluster of communities coming together to champion their development. So Aishetu underwent the empowerment model training. She is currently a key agent of change in the community. She has realized her leadership potential after benefiting from the agroecological training that was offered and the support with the seedlings and all. She took an initiative to help break the vicious cycle of malnutrition. She went further to establish her home garden. She has 5 children. Her last baby is less than 2, and she's been having challenges with malnutrition in her community. Through her home garden, she was able to grow nutrient-dense crops, focusing on tomatoes, pepper, aubergine, and orange flesh sweet potato as well. As I speak now, her garden is a very vibrant one. Her family now feeds on what she is now producing. Women are ideally the bedrock of our families, our communities, and then our nation. She is doing so well. Now she is like a role model to other community mothers in the community, and they are all emulating her impacts as well. Thank you.
Wonderful story. Thank you, Stephanie. Heather, would you like to share your thoughts?
Sure. Thank you so much. So I've been really fortunate to travel quite a bit with CARE, and we work in over 100 countries. So I've met incredible people, but there's one story that I would like to share. In recent years, I went to Guatemala for a project called Fill the Nutrition Gap that is in partnership with CARE and the church. And our CARE Guatemala colleagues took us to one community. And we walked into this beautiful, beautiful space, just plot after plot after plot of flourishing vegetables, fruits, herbs, berries. And I was told just a few years back, before that, it was an empty lot that wasn't being used. And now it was just absolutely flourishing. We met with the entire community, and I was able to walk through and hear stories. And we would sit and talk at a plot, and a couple things that I heard. There's one woman specifically that I got to spend a lot of time with. Her name is Debbie, and her daughter and her family. And what she shared was traditional native crops were critical. So her plot specifically, and many of the other women's, they had traditional beans, or native beans and native amaranth. but also a lot of new varieties for them. And what they were doing, she was using specifically traditional soil conservation methods, but she was also combining this with new methods that she had learned through the project, including how to create organic fertilizer with local renewable resources, which she felt was safer and also significantly reduced her cost. She also showed me the drip irrigation system that she was using, which helped with water conservation. The crops were flourishing because the crops were getting the right amount of water, but also that significantly saved her time. Then we walked over to the community seed bank that they had just built, and the shelves were lined with traditional clay pots that they were using to store seeds, shelf after shelf. And they were opening all of the pots and showing us how well these methods worked, how well they preserve the right temperature, or keep the right temperature. But she also showed me the solar panels and the new digital tools that help them to monitor the temperature inside the structure when they needed to make adjustments. And her daughter was standing there, Devi's daughter, and she shared that her daughter used to be anemic, regularly sick, regularly hospitalized. She missed school, and she shared that she did not play, which I'm looking at this young girl in front of me. She's bright-eyed. She had been engaged the whole time, walking with us throughout the garden. She had lots of energy, and I think Debbie saw the disbelief in my eyes, like, this, you're talking about your child? And so she showed me photos of how ill she had been just a few years before. And what she shared was that she felt like she was given the proper resources to feed her family well, to preserve traditional nutrient-rich crops that were important to them, to bring in new nutritious crops, and that she was able to grow enough that she could sell at markets and help with hospital bills, to help with school needs, and that she was also able to feel just happy to preserve the cultural traditions and food crops that were really important while learning new skills as well and sharing those as a community. So that is just one woman's story, but I've been really, really lucky to meet lots of women and that have a similar story. And I would say that's really what CARE stands for, is standing with women, helping them to support their needs and their goals and their dreams to help nourish themselves, their families, and their communities. Thank you for allowing me to share that.
Thank you. Great story, Heather. Thank you for that. Sushil, and your observations or comments?
Yeah, thank you, Arun. Yeah. As I discussed before, IDA develops women entrepreneurs here. And entrepreneurs are actually, they always try to solve the problem, the social problem, economic problem. And in the process, they make money. So when we talk about entrepreneurs, either women or men, people think, okay, they are working for the money. That's not the true, actually. They always try to solve the problem, and they see the business opportunity in the process here. While solving the problem, they see, okay, they can make the money. So there is a very fantastic the story of a woman from western part of Nepal. Her name is Uma Lamichane. And when we actually, we had a project, and then when we met with her, and then when we started discussing, she said, okay, she wanted to do something so that her farming actually does better. No, there were diseases, the productivity was very low, the soil condition was very poor, and then we started this human-centric design. Maybe if you have heard this human-centric design, it's basically a tool, market tool, that actually try to find the answer why this situation is happening and how it can be addressed through the market lens here. It's a kind of participatory tool. And then we realized, okay, what the skill set she has, what the knowledge she has, because we didn't want to actually do something very new things so that she cannot actually implement those new ideas. So we realized she has some skill set on agriculture, farming, and then through the human-centric design, then we actually came up, okay, let's do something on the vermicompost inoculated with the trichoderma. You can see globally there are the vermicompost, there are the trichoderma, but you hardly find the vermicompost also actually also preventing the disease. So we wanted to address the both problem, the disease problem and the soil fertility problem. So that's the idea came up, the vermicompost inoculation with the trichoderma. Then we started, it's like a startup, and then it was successful, and later it was adopted by the other market actors. And in Nepal, now after like 2 years, if you go to the departmental store, like a Walmart, there is a called Bhat Bhateni, you can find that vermicompost inoculated with the trichoderma. It's not because, it all started with the women entrepreneurship, but later it was picked up by the bigger business houses here. And it's kind of the successful, but that all started to solve the problem that Uma Laimichhane was facing. And that's a fantastic story actually we have in Nepal to share here. Thanks to Uma and thanks to LDSC for the grant actually we received so that we started here. Thank you.
Excellent. Thank you, Sushil. Oda?
Yes, I'm going to highlight 2 countries. In Liberia, World Food Program with funding from the church has supported 750 farmers, 70% of whom were women. So these farmers, these women, were introduced to climate smart practices. They were provided with equipment and tools they needed, and they had access to a storage owned by the government to store their production and to reduce post-harvest losses. As a result, these women were able to increase their production. They were able to put nutritious food on the table for their families. They did increase their income, allowing them to send their kids to school. The same women, the same farmers are selling food to schools where school feeding programs are underway. As you can see, we have now a community who is resilient, a community who understands the importance of the land or the soil. What we're doing next is to do more awareness in the country to ensure that everyone, including children and youth, understand that soil is not just dirt, it's a resource for a better future. In Kenya, the church is collaborating with a local government on a project called Trees for Food. So farmers are planting fruit trees to combat soil depletion and food insecurity in the eastern part of Kenya. What we are learning is there has been a behavior change in the country. People who used to chop trees and use them as charcoal, they stopped doing it. They understand that trees are helping them with climate change. And the same trees are providing fruits for consumption. the same trees or the same fruits are being sold and providing incomes to families, and they are able to care for their families. And when these fruits are sold, it's boosting the community or the national economy. I want to leave you with this. I understand that our care for the soil is the care for life itself. Thank you.
On that note, I want to thank the panel for sharing the stories, experiences, and I hope that was useful for the audience and a lot to talk about. But let's join our guests for dinner and continue the conversations over there. Honey, you would like to take it from here?
Sure. Thank you. So yes, each table has a reserved seat for every member on the stage. So they will come and join you, and you'll have some dialogue. Hopefully you have some good conversation and some good questions to ask these experts. I know they have a lot of questions for you and would really like to learn from you. If you're having a hard time thinking of what to talk about, raise your hand. I've got some prompts for you, but hopefully you don't have that trouble. For our global youth, I'm going to come and work with your teams individually. So please, go eat.
Thank you. Huh?
I'm going to sit at the least full table.
Yeah, yeah. Well,
Bye.